Let's start. Welcome everyone to our ENT quiz show. I am Dr. RMD and with me are Dr. Rupal and Dr. Manoj. Get ready for some fun facts and a sprinkle of med humor as we divide into 13 challenging ENT questions.
Guys, before we start, here is a pro tip. If you do not have YouTube Premium, grab your headphones and open this live video on another smartphone. Trust me, you will enjoy it better without any interruptions.
All right, guys, let's get started. Each question will have a 30-second timer, but we are saved extra time for the last four, giving you 45 seconds each. Stay sharp and keep those answers coming in the comments. Let's go.
Let's move on. We have 16 players who are going to, 18 players who are going to contest today. So here comes your first question.
Join quick.
A patient complains of eye discomfort since 2 weeks. She also gives history of nasal discharge, nasal congestion, and recurrent headaches. Due to which structure involvement is this complaint seen? And these are your four options. The time starts now.
Eye discomfort often screams orbital complications. But keep in mind that ethmoid-related structures are commonly involved.
I think don't forget, guys, that lamina praepacia is the thinnest part of the ethmoid bone and borders the orbit.
Keep an eye on it, pun intended.
The answer is lamina praepacia. Let's see the leaderboard. So we have Malcolm, who is leading right now with 80 points, followed by Tanya and Vamshi. And these three were the top three, had come in top three places in previous sessions also. So let's see. Let's move on to the next question.
Next question in front of you, now. A patient comes to follow up after modified Young's operation. Choose the correct organism involved in the diagnosis of this condition. Come on. Young people.
Modified Young's operation is performed for atrophic rhinitis. And we know Klebsiella ozonae is the usual culprit behind that smelly situation.
Yeah. Klebsiella ozonae is notorious for causing ozena, also known as fetid nose syndrome. Remember, guys, it's not just the bad vibes, it's bad bugs as well.
That was a good one.
Here we have Malcolm. Yeah. Malcolm leading, following with Tanya, Dr. Shanpriyan, and Vamshi. And at the fifth place, we have Sriraj.
Wonderful. Let's see who's going to be the next top.
Okay, moving on to the third question. So the nerve involved here is a branch of which cranial nerve? So the options are optic nerve, zygomatic nerve, trigeminal nerve, and mandibular nerve.
Let's be real. Come on, I know what is the answer. You want me to spell it out? It has branches cover sensory innervations in the area. Maxillary divisions also wides, no?
Yeah.
Exactly. Trigeminal is the sensory superstar in facial anatomy.
Quite good.
Oh, we have Vamshi back.
Vamshi was just like a streak person. He's running the streak.
Yeah.
Followed by Dr. Shanpriya, Sriraj, and Sanjana. Congratulations, guys. Moving on.
Here is your fourth question. According to your diagnosis, choose the correct option. The hint is it's 40 puff tumor. So these are your options. Your timer starts now.
Potty puff tumor, also known as Potts puff tumor, involves the frontal sinus osteomyelitis. And what do you think? Orbital complications. See? Check.
Yeah, never underestimate it. It's a surgical emergency.
Well, it is.
Let's see the
Okay,
leaderboard. So after 4 questions, we have Vamsi leading with the longest streak so far, followed by Sriraj and Dr. Shan and Narasimha. Sriraj and Dr. Shan, I guess, are new candidates here, new contestants. So it's good to see new people coming up and bagging top 3 places. Shall we move on to the next one?
yes, yes, sir.
Vivid neurectomy is done for. What do you think, Manoj?
Think Vidian neurectomy targets the parasympathetic fibers. This makes it perfect for the vasomotor rhinitis condition.
Yep. Say goodbye to that nasal overreaction.
Oh, we think we got most of them choosing right.
Hey, good guys, good. People are actually studying.
Yeah.
Vamsi, the streaker. And then we got so many. Let's go. Second is Sriraj, Tanya, Narsimha, Ashish, Dr. Shantriyan, Malcolm, Hemant. Look, Hemant has also joined. Subha, Soumya. We remember you, Soumya, the 2 Soumyas. Congratulations to all of you guys. You guys are doing great. Just remember, every question has its point. So the fastest way to score is clicking and knowing the answer accurate and in good time. Let's see if you can do that in the next question as well. Choose
the right option here, guys. I think there's a visual clue for you. Let us see who guesses the answer right.
Was it
This is really interesting and a very unique question.
I think someone who made this question likes beaches or water.
Maybe. Let's see how many of them got it right. Oh,
Currently, most of them.
I guess it was easy question.
Yeah,
The clue was clear.
it was kind of. Oof. See, I was right. See, the fastest person is Sriraj, and he got 77. Vamsi got 60 points. So, guys, see, every question can break and make. So, give it your all.
Here is your 7th question, guys. The first step is an infundibulotomy. So that involves which of these following options?
It's a mixture of 2 questions, 2 surgeries. And imagine, do you know any surgery other than these 2 who have the first same step? Guys?
I think
I don't remember anything from ENT.
Let's see. All right, yay. Good.
Is this a PYQ?
Yes, it is a PYQ.
Oh my God. So those who are attending this quiz are going to benefit a lot even though they haven't studied ENT.
Imagine. That is definite. That is definite. Woo,
okay,
congratulations.
we have Ashish again in 3rd place today.
Oof.
Let's see if you can make it to the 1st or 2nd.
Yeah.
It's us. Who knows this? Who?
Okay,
Best.
FES is done for.
Is this a fill in the blanks?
So could you repeat?
Is this a fill in the blanks question?
Yeah, it's like an open-end question. So people are
Okay.
allowed to type. Like there are many things that can FES can be done, right? So it was just kept an open end. Let's see how many people and what they type.
Okay.
Woo! We'll get you. The answers will be disclosed later, so we'll let you know.
Oh, okay.
Right now, we have Sriraj who is leading, and he has the longest streak, followed
It's
by
okay.
Vanshi and Ashish. Did you see those sad emojis? I guess we
Yeah.
should make it wrong.
Guys, no one got points. Chill out. No one got points. It's a mystery one. It's just to tell you or to test your knowledge if you know the basics or not. Moving on.
Okay.
So, guys,
I
this is a
think, I think epistaxis is one of the very important topic in nose,
yes.
and this summarizes in a good way.
That is true. That is true.
My first impression when I saw the question was Foley's catheter, and I was like, why is Foley's catheter even in this ENT quiz?
Well, it is. If I would tell you now, they would know the answer. But
Oh, okay.
yeah,
I would be curious to know. Okay, so we use Foley's catheter for post nasal packing.
definitely, definitely.
Oh, this is something new for me.
All right. Sriraj being the longest and the having the rocking streak of
You
8
see,
questions.
yeah, the consistency requires to have a streak of it. I haven't seen anyone in this past 5 sessions who has had a streak of 8 questions.
That is quite an observation. Sriraj is, I think Sriraj is like the one who has done ENT thoroughly.
Yeah, I guess he has come
Yeah.
here to win. Moving on to the next question. Okay, I really admire the mind behind this question. It's a great question. Okay, picking up each symptom and then fitting them in these syndromes.
Yes.
It's really interesting. It's a very unique way of of learning. It's a very unique way of learning. And here you're competing against time.
Yes, sir.
Thank you. Thank you. You know, the most often things that I think as a medical we often miss are the signs and symptoms. We think everything might have the same thing. I remember my pharmacology exam where we used to always see the side effects is just nausea and vomiting.
Yeah, true.
So I think this way, categorizing the questions and knowing exactly what symptoms goes with what just helps and gets a very big clarity for the basics.
Yeah.
Wow. Tanya is back in the game.
Hats off to
And
Sriraj. He is just rocking.
He's just
Moving on to the 10th question. Okay,
so
again,
maths,
wonderful
yeah,
question.
yeah.
I'm a fan of this type of question. I think there are many more symptoms here.
yeah.
So we have cystic fibrosis,
Anticonate.
yeah, and allergy association, and rhizomycin. I think these type of questions are the ones where students get confused in INICET and NEET. Like these are the like bilateral nasal polyp and unilateral nasal polyp are such close DDs. So in the options when they are finally left out with 2 options, students get confused with these type of options.
Right. Right.
I think most of them are getting a good answer, sir, here within 30 seconds. So I guess they are pretty fast to answer.
Yeah. I think most of them have done it right. 16. That's some good.
That shows the level of competition.
Wow. Wow.
Oh my God, Sriraj. Thanks to you.
Sriraj.
Drum rolls, dude, drum rolls.
Exactly. I'm going to give drum rolls for him. No one has done this before. It's like the golden buzzer.
Congratulations, Sriraj. It's commendable.
Followed that, we have Vamshi, Dr. Shanpriyan, Tanya, and Ashish, followed by Hemant.
Mhm.
I think ENT is his favorite subject for Sriraj.
Sriraj.
Could be. He can pursue PG in ENT.
Orentology. Uh,
Here is your 11th question.
this question has many perspectives. If you look closely, everyone has its name and everyone has its diagram. But what exactly it is and where it is the question over here. So, see, imagine you're reading a clinical question, right? And right now, you have just in your mind just want to highlight the points in the clinical questions. These are those points that you will highlight to make a diagnosis. So, if you can do and match now, you mostly have like all you're done with nose. Let's see who got. Wow, people know. Congratulations, guys. Keep the winning streak up.
The last question, right?
Second last.
So we have 13 questions.
Yes.
Okay, these are easily answerable questions. Like these are the questions where we shouldn't lose marks in entrance exam. These are straightforward, easy scoring questions.
And to make it a point, guys, it is INI, it is NEET, it is the questions that will be asked in your prof also. These are those basic questions.
Some of them have answered it correctly. Oh my God.
Oh,
Okay, so this was the last
that
question.
streaks.
And Sriraj, it's great. Getting all the questions correct. Never happened in the history of JuxtaMed quiz before.
Oh my Lord. Sriraj, a heartiest congratulations to you. You've been doing commendable.
Congrats, Sriraj. Congrats, Vamsi. And congrats, Dr. Shan.
Dr. Vamshi has again landed up in second position. Impressive. Dr. Shan and Vamshi have a difference of just 1 point,
Ooh.
Yeah.
followed by Dr. Tanya, Narasimha, Ashish, Malcolm, Hemant, Soumya, and Tamzil. So these are our top 10 winners for this ENT quiz. So guys, come to YouTube Live where we'll be posting the presentation part and the recap part and the prize distribution ceremony for the last quiz.
All right, guys, we are here with explanation and few tips and tricks.
In the last session, which was conducted on December 3rd, we have Dr. Vamshi, who is the winner of this quiz, and he has won Amazon voucher, which is a cash prize. So, congratulations, Vamshi. You have been the only JuxtaMed contestant to have won JuxtaMed quiz twice. So congrats.
Congratulations.
Congratulations.
For second place, we have Dr. Saurabh, and third place, we have Dr. Ashish. So all these three, Dr. Vamshi will be receiving certificate as well as Amazon coupon voucher via email. Okay, we'll be sending your cash prizes via email. And Dr. Saurabh and Ashish will be receiving certificates via email. Congrats, Dr. Vamshi, Saurabh, and Dr. Ashish. So here we move ahead to the recap. Over to you, Dr. Rupal and Dr. Manoj.
Starting
Yes,
with you, Dr. Manoj.
so guys, yeah. So guys, we had a many question on sinusitis and related complication and the procedures also. So here, this slide, I think it summarizes all the points here. So coming to the cribriform plate, if the cribriform plate is injured, it leads to CSF rhinorrhea. And same way, if the ethmoidal cells are involved, it leads to ethmoidal sinusitis. And also, if lamina papricia is damaged during any procedure or surgery, it leads to orbital complication. And also, if we summarize the meatus and its contents, in the superior meatus, we have sphenoid posterior ethmoidal sinus opening, whereas in middle meatus, we have also called as a osteomeatal complex, as it is the most congested one. We have the opening of anterior ethmoid, maxillary, and frontal sinus. In the inferior meatus, we have nasolacrimal duct opening, which is guarded by a valve of Hasner. And also one point to remember is that if there is an injury in superior meatus or its surrounding structure, it can lead to the injury of internal carotid artery and optic nerve as well. Okay. This will be explained by Dr. Rupal.
Okay, guys. So Rhinosporidium sebri is initially believed to be a protozoan. It is classified under fungus. We need not remember the name, but just understand that it's classified under the fungus and recently placed under drips of aquatic protestian parasites. So basically now Rhinosporidium is now called a aquatic protestian parasites, and PCR tests have not demonstrated any fungal protein. This is a little update about Rhinosporidium sebri, and with this we conclude our today's quiz and the explanation.
Rick, we have. Okay.
So
We have one more slide, sir. One more slide. Okay. So this slide actually explains all the complications related to sinusitis as well. So here we have three important complication if we categorize. One is bony complication, orbital complication, and intracranial complication. So the most common complication involves the orbital area, which can lead to orbital cellulitis, periorbital edema, and superior orbital fissure syndrome and orbital apex syndrome. In bony complication, we had one question which had a pot puffy tumor, as you can see in the image, which is nothing but the osteomyelitis. And in intracranial complication, it can lead to subdural abscess, frontal abscess, meningitis, and cavernous sinus thrombosis also. So this is a quick recap of the quiz today. Hope it helped you to revise. Thank you.
guys, there is an announcement. So those who want to watch this video, these videos will be uploaded in official JuxtaMed YouTube channel. Okay, we have a YouTube channel called JuxtaMed Quiz. So there will be uploading these videos on YouTube in the YouTube platform. Okay, and also you can follow us on Instagram where all these details will be uploaded. Our Instagram page is again JuxtaMed Quiz. You can also follow us on other platforms. So you can follow us on X, that is Twitter, and
Threads.
yeah, so you can follow us on these platforms. Okay. For updates on quiz, like when the quiz will be conducted, and on the updates like when the link for the quiz and all will be shared in Telegram and WhatsApp channel. Okay, so once you have joined Telegram and WhatsApp channel groups, it will be forwarded to you. So I guess that's it for today. So that wraps up our ENT quiz show. Thank you for joining us. And remember, the key to mastering ENT is curiosity and patience.
Good saying, good saying.
Stay
So,
tuned for more quizzes and humor, guys. See you all in the next quiz.
and drop your scores in the comment section and let us know how you did. So, did you ace it or learn something new? So, comment in the comment section of this video. Thank you so much.